Hey, so all, welcome back to my YouTube video. Today we are going to study about parotid gland. Okay, so before beginning with the parotid gland, we have studied that there are three types of major glands and many minor glands. So our major glands are parotid gland, submandibular gland, and sublingual gland. What are the ducts basically associated with them? As all of us find it very difficult to remember the duct, even if knowing it correctly, sometimes it gets wrong. So just I am telling you about this, so please listen to it carefully. The duct of the parotid gland is Stenson's duct. The duct of the submandibular gland is Wharton's duct, and the duct of the sublingual gland is duct of Rivinus or Bartholin's duct. Okay, and you should remember which gland is serous and which gland is mucus, as all of us found very difficult to remember this, which is serous, which is mucus. So you can remember it very carefully. Our parotid gland is purely serous, but our submandibular gland and our sublingual gland are mixed gland. Okay, mixed basically involves, it consists of both serous as well as mucus, and serous as well as mucus. But at the submandibular gland, they have the higher serous and low of the mucus gland, while in the sublingual gland they have the more mucus gland as compared to serous gland. So this you have to remember about the salivary glands, the major salivary glands. Now we will study about the parotid gland. And what is the location of the parotid gland? Basically it is found in the upper molar region. Okay, now we will study what is parotid gland. Okay, parotid gland is the largest of the salivary gland. It has a weight of 15 to 25 gram. Okay, and it is a capsule, that is, we have studied in the previous video, that is the deep layer of cervical fascia. It surrounds the parotid gland and the submandibular gland. So it is capsule or lined with investing layer of deep cervical fascia. Okay, so it involves two laminas, superficial lamina and deep lamina or lamina, whatever you want to study. Okay, like I am drawing in this diagram, like this. One you have to remember is that deep lamina is thin and superficial lamina is thick. So in this diagram you can see this thick one is the superficial one and this thin one is the deep one. Okay, and this is the investing layer. Deep lamina is usually thinned, okay, but at one point where it gets thickened, that is the stylomandibular ligament. Usually it is thin. The point where it gets thickened, that is the stylomandibular ligament, and this stylomandibular ligament separates our parotid gland from the submandibular gland. Okay, then we are going to discuss, this is the weight, this is the capsule, and this is all what I have discussed with all of you. Okay, then what are the three borders of parotid gland? Just all of you are watching in this, it has anterior, medial and posterior. These are the three borders of parotid gland. What are the three borders? Anterior, medial and posterior. Okay, then the parotid gland has 4 surfaces. What are the 4 surfaces that are involved? Firstly, it can either be superior surface, then it can either be superficial surface, then as per the name suggests, anterior-medial, or it can either be posterior-medial. Posterior-medial. Okay. 3 borders are the anterior, medial and posterior borders, and the 4 surfaces are the superior surface, superficial surface, anterior, medial and posterior medial. Okay. I'm telling all of you in brief, so you have to study your chorussia for brief description. Tongue slip. For brief description, you have to study about parotid gland from the BDC chorussia. But when it comes for small things like for 5 marks, or you want to get some knowledge, you can watch this first and then study your BDC chorussia for better understanding. Okay. Then we will study about what are the contents of parotid gland. Basically, it involves artery, it involves a vein, and it involves a nerve. Okay, artery, it involves the external carotid artery. Vein, it involves the retromandibular vein. Okay, so for the nerve supply, we are discussing it below. It involves the sympathetic, parasympathetic and the sensory divisions. Parasympathetic, sympathetic and sensory divisions. Okay, parasympathetic basically is secretomotor. Sympathetic one is basically vasomotor, and sensory one basically involves 2. It involves auriculotemporal nerve and greater auricular nerve, that is C2 and C3. Nerve supply is from parasympathetic, sympathetic and from the sensory root. Parasympathetic one is secretomotor, sympathetic one is vasomotor, and sensory involves the auriculotemporal nerve and the greater auricular nerve. So in this I will teach you about what are the cores of the parasympathetic nerve. So listen to it carefully, it is very important. First of all, it will begin with the nucleus here, that is the inferior salivatory nucleus. I will write down here, inferior salivatory nucleus. From here it will begin, along with the which nerve? That is 9th nerve, that is called the glossopharyngeal nerve. Then it will involve the tympanic branch, like this is a plex, or you can say a branch, so it is called as tympanic plexus. Then it will travel through lesser petrosal nerve, okay. Then here it is the parotid gland. Then there will be the ganglion present, that is called as otic ganglion, and further downwards there will be the auriculotemporal nerve. You have to remember this pathway as such. First of all, it begins from the inferior salivatory nucleus, goes down with the help of glossopharyngeal nerve involving the tympanic branch, then the tympanic plex. Further, with the lesser petrosal nerve, it goes down to the otic ganglion and thus reaching the parotid gland involving the auriculotemporal nerve. You have to remember this. The lesser petrosal nerve, this is the, I will write down here once more for all of you. This is the lesser petrosal nerve. Lesser petrosal nerve involves the parotid gland, and the lesser petrosal nerve involves the parotid gland involving the glossopharyngeal nerve, and greater petrosal nerve is seen in the case of seventh nerve or the facial nerve. I will write down for all of you here the important points. Lesser petrosal and greater petrosal nerve. Lesser petrosal nerve is associated with ninth nerve and it is involved with seventh nerve. It is involved with seventh nerve. Lesser petrosal nerve involves the parotid gland. So you can draw this course to explain the parasympathetic nerve supply. Okay, I will discuss the parasympathetic nerve supply with all of you again. First of all, it involves the inferior salivatory nucleus involving the glossopharyngeal nerve. It involves the tympanic branch, then the tympanic plex, then it involves the inferior petrosal nerve, then it goes down to the otic ganglion along with the auriculotemporal nerve. It supplies to the parotid gland. Okay, arterial supplies with the external carotid artery, and the venous supplies with the help of retromandibular vein. What are the three borders? Anterior, medial and posterior. What are the four surfaces? Superior, superficial, anteromedial and posteromedial. And it is surrounded with the investing layer of deep cervical fascia involving the superficial lamina and deep lamina. Superficial one is thickened and the deep one is thinned. The point where the deep lamina is thickened, it is called as the stylomandibular ligament, separating our parotid and the submandibular gland. Okay, so this was all in short about the parotid gland. Do listen to this nerve supply. It is very important and you can draw this diagram in your paper as such. It will add marks to your presentation or your question. So thanks for watching. Do like and share and subscribe to my channel if you want such more video. Thank you for watching.